Hello.
Hi.
Hi, James.
How are you?
I'm doing well. How are you?
I'm alright. I've been better.
Been better. Okay.
Yes.
That is understandable. I know not everyone loves coming to the dentist, so I don't blame you there.
Thank you.
So what's going on? I know I saw you in a couple of months ago. What brings you back today?
I'm still having an issue with that same tooth.
Okay.
If I drink cold water, cold ice cream, water ice, it's not a good time.
Okay. So you're having some sensitivity.
Yes, very sensitive.
Very sensitive. Okay. Okay. Let me go ahead and get you checked in, and then we can get started with your prelim stuff. So, okay. So it's the same tooth. Is it bothering you like all the time, or really only when you eat something cold?
Just cold.
Just
cold. Cold, yeah.
Okay. But it's pretty frequent.
Yes, it is. It's every time.
Okay. Does it also happen when you drink anything cold, like ice water, iced tea?
Ice water for sure.
Got it. Can you describe the pain for me? Is that like a sharp stabbing pain or kind of like a dull, achy, throbbing?
It's a dull, achy, throbbing.
Achy?
Yeah. Probably lasts about 10 or 15 seconds.
Okay, so it's, I see. Okay. Got it. And is it just the one tooth that's bothering you?
Yes, it seems to be.
Okay. Perfect. Okay. So let me just ask you a couple questions. So it's the one tooth that's bothering you. I know it's the one that we already worked on, and you had your cavity done there, right? He replaced that cavity for you?
Yes, he did.
Okay. So aside from that, is there anything else that you want me to relay to Dr. Perez today?
No, I don't think so. That's really the only thing that's bothering me.
Okay. So I know Dr. Feinberg did your cavity replacement. He's a dentist, not an orthodontist, so we will have the orthodontist come in today. So it'll be a new doctor. Her name is Dr. Perez.
Okay.
So what's going to happen is after I finish your intake, I'll get some impressions done for you. She'll come in and do your regular assessment, your regular checkup since you're here, and then have a look at the impressions that I've taken, and we'll kind of see where she wants to go from there.
All right.
It's highly likely that the tooth is going to need to be pulled. Not sure if she'll want to do that today or not, but that's something that we can go over with you, okay?
Okay, I'm fine with that.
Perfect. Okay. All right, so I think the only other question I have is, have you been experiencing any other symptoms like bleeding of the gums, anything like that? Any issues with brushing? Nope. Still brushing twice a day, flossing every day?
As well. Yeah.
Okay.
No other issues.
Perfect. All right, well, all of that looks great. Let me go ahead and lay you back and get your impressions taken, and then I'll have Dr. Perez come in when we're done, okay?
All right.
Alrighty, so you just relax for me. I'm going to go ahead and recline you. So I'll have you sit up for just a sec. And then we're going to go ahead and relax. There we go.
Okay.
All right. I'll come behind you and we'll get started.
Okay.
All right, James. You all ready to go ahead and get started?
Yes, I am.
Perfect. Okay, so I'm just going to go ahead and get my gloves on, and then we can proceed. So I spoke with Dr. Perez. I went ahead and consulted with her about your last appointment and then the symptoms you're experiencing today. She did speak with Dr. Feinberg, and they both agree that it's probably best that the tooth comes out. Okay, so what I'm going to do is get you nice and numbed up. That way when she comes in to do the extraction, you're already good to go. And then I'll also get your impressions taken. That way we can go ahead and get started with the crown replacement, okay?
All right.
Okay. Are you comfortable in the position that you're in?
Yes, I am.
Okay, perfect. So why don't we go ahead and start with the numbing. So just have a syringe here. I'll go ahead and show you. I'm going to be giving you about 1 ml of the lidocaine injection, okay? So it is a fairly decent sized needle. You'll feel like an initial pinching sensation, and then it shouldn't hurt. You won't feel the liquid going in. If anything, you might feel just a little bit of a cold sensation, and then you should feel pretty numb fairly quickly, okay?
All right.
Okay, perfect. All right, so let's go ahead and get started. Let me just make sure that this is all good to go. Just gonna draw out any bubbles that might be hanging out. All right, so we're gonna go ahead and get started. If I could have you open up for me.
Sure.
And I am going to insert my needle. You're gonna feel a little pinch, okay? 1, 2, 3. And I'm pushing the medication. You doing okay?
Mm-hmm.
Okay, removing the needle here. Okay. We'll let that sit for just a couple seconds. Just gonna catch any of that saliva that might be hanging out on the outside. Okay. Okay, so that's gonna take about 10-15 minutes to fully kick in. You should feel that your face is completely numb on that side. So while that's working, I'm gonna go ahead and get your impressions taken, okay? All right, so let me just start by getting you dressed. That way we don't worry about ruining your shirt. So I just have a little sterile cloth here that I'll be using to cover you up. Alrighty, James, does that feel okay?
Yes.
Okay, so let's go ahead and get started with our impressions. And the first thing I'm going to do is just do a quick suction of your mouth. That way any excess saliva that you have doesn't get in the way of the mold. So if I can have you just open up for me. Just a light suction here. Perfect, okay. Okay, so I'm gonna do 2 different sets of molds. All right, James, so if I can have you open up for me, open wide, and I'm gonna go in with my impression. Let's go ahead and open so I can take this out. It's gonna be a little tight. Perfect, that's a good looking mold. Okay, and then we'll just go in and do our second set here. So let me just make sure that the putty is ready. Okay, so go ahead and open up for me and close. Bite down really hard. You can kind of wiggle your teeth back and forth for me. Good. Okay, go ahead and relax. And I'm going to have you open up for me. Okay, perfect. Very good looking impression. So just a little putty indentation there. So we will get those casted for you. I should have that ready by the end of your appointment here. So that is good news. Let me just suction you one more time. Okay. All right, so you are good to go. I'm going to leave you with a little cup of wash here. If you'd like to rinse your mouth out, you can rinse and spit into the basin. Dr. Perez should be in with you in just a few, okay? Okay, thank you very much. All right, James, how's it going?
It's going good.
It's very nice to meet you. My name is Dr. Perez.
Thank you.
I was speaking with my assistant, and she said that she got your impressions all taken care of.
Yes.
Perfect. Okay, well, we can go ahead and get started with our portion of your examination today, if that's okay with you.
Okay.
I'm going to start by just getting my gloves on. So I've just got a pair of sterile gloves here that I'll be applying. If it's all right with you, can I use you as the table here?
Sure.
Okay, perfect. Okay, so I'm just going to open up my gloves. All right, James, so we can go ahead and get started. As I stated, it's very nice to meet you. I did speak with Dr. Feinberg, who is your regular dentist. So it looks like he did a filling replacement for you about 4 months ago.
Yes.
Okay, and you're still feeling some pain in that area?
Yes, I am.
Okay. So I do think the tooth needs to come out. I had a look at your x-rays. It looks like, unfortunately, the filling for that cavity is not going to be enough to hold that tooth. So what we're going to do is go ahead and take it out. I believe Sarah said she already gave you the numbing medication, correct?
Yes.
Okay. So first thing I want to do is see how numb you are. Do you feel like you're feeling anything on that side?
No, it feels pretty numb.
It feels pretty numb. Okay. So I'm going to touch your face and I want you to let me know if you can feel anything, okay? You feel my hand here?
Yes.
You feel it here?
Yes.
Both sides here feel the same?
Yes.
How about here?
No, the left side is numb.
Okay, so you can't feel anything here.
Right.
You feel my hand here?
A little bit, yeah.
You feel it here?
Less.
Okay. Can you feel me touching your lips?
Yes.
Okay, so you might still need to numb up just a little bit there. Can you feel me down here?
Just a little bit.
Just a little bit. Okay. Let's try. I'm going to do a little bit of a pinprick sensation here. So this tool is pretty sharp. Can you feel that that's sharp?
Somewhat.
Somewhat, okay. So I don't think you're quite ready yet. I'm going to give you a couple more minutes with the numbing, but we can go ahead and get started with the rest of your visit. So while you're here, I do want to go ahead and just kind of do a general once over of your mouth, if that's okay.
Sure.
Okay. So oddly enough, most dental exams actually have a lot to do with the rest of your face. So looking for things like symmetry or asymmetry, any abnormalities that can indicate any issue with your jaw. Okay, so I'm going to be having a look at your face to start off with. So I've got a little bit of a bright light here, and I'm just going to shine this over your face, and I'm just looking to see if there's anything abnormal with the symmetry of your face. So essentially just shining my light directly over your nose and looking to see where exactly the shadow lies on both sides. That looks okay. Okay. Also looking for any notable swelling. I think that's all right. Okay. All right, James, so I'm going to perform a couple palpations. What that means is I'm just going to be feeling around your face, okay? So I want you to let me know if any of this is painful or if any of it feels abnormal. Essentially just feeling for any abnormalities along your jaw or any issues with TMJ, which is a joint disorder. So feel any pain or discomfort here? You ever hear any clicking or popping in your jaw?
No.
Can I have you open for me and close? Open and close. Again, open, close. One more time. Perfect. Okay, so I didn't feel anything there. So I'm just going to be feeling along your bone structure here. So following the orbital socket down to the temporal mandibular joint here. Very good. Do you ever catch yourself grinding your teeth at all?
Every now and then.
Okay. Is that while you're awake or while you're asleep?
Sleeping.
You ever experience any headaches or migraines?
From time to time, yes.
Open for me. Close. Good. Okay. So I'm going to perform a couple percussions. You're essentially just going to tap around your face with the little hammer here, okay? So I'm just looking and listening for any abnormalities. Again, just testing to see if there are any sensitivities or anything more serious that we should be looking out for with that TMJ. Any pain here?
No.
Can you feel this?
Slightly, yeah.
Do you feel it or do you just kind of feel like a sensation, like the pressure of me touching you?
Pressure.
Okay. Does it feel the same on this side?
No, I feel it more on this side.
Okay. Good. Have you hang your jaw open for me, just very lazily. Good. Okay. You feeling pretty numb now?
Yeah.
You feel this at all?
Feel a little bit, yeah. I'm going to go ahead and have a listen with my stethoscope and just using this to listen to the circulation of your face. So just relax for me, take some normal breaths. All of that sounds pretty good. Alright, James, so you should be pretty numb now. I'm going to go ahead and try that pinprick tool one more time. So can you feel that this is sharp? No? Okay. And lastly, if I could have you open for me. You feel this at all? Okay, good. Alright, so you are fully numb and we can go ahead and proceed with your extraction. So I'm going to have a look at the tooth and see what exactly I'm going to have to do here, how difficult it's going to be for me to take it out. Just putting on a pair of special glasses that's going to allow me to better visualize the area. It's going to be a little bright. You might want to keep your eyes closed. Okay. Okay, so I'm going to go ahead and have a look here if I can have you open up for me. The tooth. I see where the cavity was replaced. Okay, so I see a little bit of a crack here. It does look like the tooth has split down the middle, which is probably why it's hurting so much. A little bit of that nerve is exposed, but it's not too bad. You can't feel this, correct? Okay, good. Alright, so I think we're going to be able to pop that out pretty easily. So what I'm going to do is use this tool. It's got a little bit of a scoop on it, and I'm quite literally just going to put this up underneath your gum and see if I can pull that tooth out, okay? Okay, so I'm going to have you bite down on this for me. Keep that there for just a second, okay? Try to make this as painless as I can. Okay, so you should feel some pressure, but it shouldn't hurt. Going underneath the gum. You're doing great. Okay, I got it wiggled out a little bit. Tooth was definitely ready to come out. Okay, one big pull. Okay. Look at that. Not too bad. It came off pretty cleanly, so that's good. Maybe give you a little bit of suction there. Good. So just a little bit of bleeding. Not too much, which lets me know that that tooth was really ready to come out of there. Okay, so that's actually good news. And having a look at those impressions that the assistant got for me. So that blue one here is the tooth that was just pulled. Okay. So it's the second one from the back. So you will feel a little bit of a hole there. Try not to play around with it too much for now, okay? So what we're going to do is take these impressions. These ones are a little bit deeper here. And I'll use these to create a plaster mold, or rather the assistant will create a plaster mold. And that'll allow us to have your porcelain crown ordered, okay? So we will get those all sent off once your molds are made. And might as well send you home with a keepsake. So I'm going to put your tooth in this cute little container, and you're welcome to do with it what you will. But let's go ahead and proceed to the rest of your examination now that we got that tooth taken care of. Okay, so what I'm going to do now is take a little swab here of your cheek.
So I'm just going to take a little swab of your cheek, and this is going to help me determine if you need any antibiotics, okay? So go ahead and open up for me. So if I do find that there's any infection in there, then we can go ahead and get it treated. That way it's not festering and getting worse before we get your crown put in, okay? So those results won't come back for about 48 hours. Should you need a prescription, it will be oral, likely a capsule. So I'll just call you and then you can head over to the pharmacy, okay? Okay. We've got your pharmacy on file?
Yes.
Okay, perfect. All right, so let's go ahead and move on. And I do just want to have a look at the rest of your teeth, of course. So going back in, I know you still feel pretty numb. That should last for at least a couple hours. So I'm going to have a look at the surrounding teeth. Make sure there's nothing going on structurally. Your teeth actually look pretty healthy. Dr. Feinberg did say that you keep up with your appointments, so that's good news. Very good. Having a look at the front and the bottom teeth. Very good. So I know you had a cleaning about 4 months ago, and I'm not seeing any excess plaque buildup. So the space between your teeth looks very healthy, which is great. Open wide for me. Good. Good. Can I have you stick your tongue out? Tongue looks good. Okay. So just switching out my suction tool here. Okay. This one just has a little bit of fluoride on it. It's going to help protect those teeth and also cleanse the area that was extracted. So just have you open up for me. Just feels like a regular toothbrush. Got a little bit of suction on it since you're still salivating from that numbing medication. Do you ever have any issues with your gums?
No.
Good. Okay. Have you open up for me? So your bottom teeth are a little crowded. Not too bad, so I would say you're about a -1. Those bottom teeth. Top teeth. A couple of them are about a 0.5, but you do have a little bit of a gap here. Okay. A little tight on the sides. Okay. You floss every day?
Yes, I tried so.
Very good. You just test something out here. Just using my spacer tester. So there's little notches here. It just allows me to see how tightly packed your teeth are. So your bottom teeth are a little crowded. It's definitely cosmetic. It's nothing that I would say is hindering your dental hygiene. So you're able to floss regularly. Do you ever have issue getting the floss out of your teeth? Does it get stuck? Not really? Okay. So they don't look too bad. If you are ever interested, I could fit you for Invisalign. I think you'd be a good candidate since you don't have a whole lot happening. Just some very slight crowding that we could push apart, probably 6 or 8 months of Invisalign. So you can let me know if you're ever interested in that, but I don't think it's anything that's super pertinent or necessary at all, okay?
Okay.
All right, so that's very good news. All right, James, so I think the last thing I'm gonna do is test your bite and test your gag reflex. Make sure that all functions are a go. So if I can have you stick your tongue out for me. A little bit of an annoying test, say ah. Good. Gag reflex is intact. Apologize about that. Next, I'm just gonna test your bite strength, okay? So I have a bite block here. Might be a little bit weaker on this side because of the numbing, but that's okay. So I'm gonna have you open up for me. Can you bite down? Very good. Open again. Big bite. Bite down. Good. Right in the middle. Good. This side. Good. One more time. Very good. Very strong bite. Okay. Any pain with any of that? Did you feel like any of your teeth were loose or moving around?
No, I didn't.
Okay. Very good. All right. Let me go ahead and suction you out one more time. I'm going to be producing excess saliva until that numbing wears off, likely for another 2 hours or so. I can send you home with a little bag to spit in if you need it. And then, of course, I do want to go ahead and have you take home your tooth, your little keepsake here, okay? All right, so you are good to go. I will have Sarah come back in. She'll get you all settled with your to-go bag of your toothbrush and everything, and then you'll be good to go for today, okay?
All right, thank
All
you.
right, well, it's very nice to meet you. Thank you very much.
Sure.
Hi, James.
Hello.
How's it going?
Pretty good.
How'd it go with Dr. Perez?
That wasn't that bad.
Wasn't bad. She's very good. She tends to keep it pretty short and sweet. She's efficient, but she gets the job done. Are you feeling okay? Pain's not doing too bad?
It's not too bad.
Okay, good. Let me go ahead and get this off of you here. So I'm sure she explained to you you will be experiencing a little bit of excess salivation for the next 1 to 2 hours. That's totally normal. You'll likely see a little bit of pinkish tinge, just a little bit of blood coming out of that site. I would like you to leave it alone. Try not to stick your tongue in there or play around with it too much. I know it's tempting because it feels very weird, but just let it hang out for a couple days, okay? Once I get your impressions plastered, I will get those sent off to the lab. They will make that porcelain crown for you. We'll probably have you back in about another 2 weeks, okay?
All right.
Okay. So she did take a cheek swab from you. I'm going to get that sent off, see if you need any antibiotics. You likely will not, but it's safe to go ahead and let you know. So I will send that to your patient portal. I can also give you a call if you prefer.
Okay.
Okay? All right, well, you are good to go. I'm gonna send you off with your tooth.
Thank you.
And then should you need to spit in the car, there's a little bag for you to take home with you, okay?
Thank you.
All right, James, thank you so much. You have a good night.
All right.
Get home safely.
Thank you.